Say goodbye to overwhelming textbooks and hello to vibrant, interconnected mind maps. We welcome you to our new series of videos where we pick each mind map from our mind map bundle and help you run through all the important points you need to remember for your exams. You can browse our app while watching this video and download the mind maps for enhanced retention. So, let's get started. In this mind map, we will go through some important concepts of public health. Firstly, coming to concepts of causation. They include various concepts such as epidemiological triad, multifactorial causation, natural history of disease, web of causation, risk factors and risk groups, spectrum of disease, and finally, iceberg of disease. Among these, the most important ones to remember for your competitive exams are epidemiological triad, web of causation, and iceberg of disease. Let's go over these in detail. First one is epidemiological triad, a model that represents the interaction between three key components in the development of disease, which are the agent or the biological or physical factor that causes the disease. For example, bacteria, virus, or a chemical. The host or the individual or organism that is susceptible to the disease, and the environment, which is external factors such as physical, social, and cultural factors that influence the interaction between the agent and the host. Next one. The web of causation is a model that recognizes that certain chronic diseases result from the complex interaction of multiple factors, including social, environmental, and individual level factors. It emphasizes the interconnectedness and interdependency of these factors in the development of disease. Lastly, the iceberg of disease concept suggests that the visible or diagnosed cases of a disease represent only a small portion of the total burden of the disease in a population. The majority of cases, including mild or asymptomatic cases, remain unrecognized or unreported, similar to the larger submerged portion of an iceberg. You can go through the rest of the concepts as shown in our mind map. Coming to the next part. Primary healthcare is a comprehensive approach to healthcare that focuses on providing essential health services to individuals and communities. It is based on the principles of equity, community, participation, intersectoral coordination, and the use of appropriate technology. PHC aims to ensure that essential healthcare is accessible, affordable, acceptable, and available to all individuals and communities. The hallmarks of primary healthcare are affordability, acceptability, accessibility, and availability. And its principles include equitable distribution, community participation, intersectoral coordination, and appropriate technology. The elements of primary healthcare include education about prevailing health problems, methods of prevention, and control. This involves raising awareness and providing information about common health issues and promoting preventive measures. Next is promotion of food supply and proper nutrition, which includes efforts to ensure adequate food supply and promote good nutrition practices to improve the overall health and well-being of individuals and communities. Supply of safe water and basic sanitation is the next element. Access to clean water and basic sanitation facilities is essential for maintaining good health and preventing the spread of diseases. Primary healthcare places special emphasis on maternal and child healthcare, plus family planning. Vaccinations are also a vital component of primary healthcare, aiming to prevent the occurrence and spread of vaccine preventable diseases. Next element is prevention and control of endemic diseases. Primary healthcare focuses on the prevention and control of diseases that are prevalent in specific geographic regions, such as malaria, tuberculosis, or HIV or AIDS. Treatment of common diseases and injuries, and lastly, provision of essential drugs are the final elements of primary health. It includes the provision of essential medications, ensuring that individuals have access to necessary drugs for their health needs. The levels of prevention in healthcare are categorized into three main levels: primordial prevention, primary prevention, and secondary prevention. Additionally, there is a fourth level known as tertiary prevention. Let's go over a breakdown of each level. First, coming to primordial prevention. This level of prevention focuses on preventing the emergence or development of risk factors for diseases. It aims to address the underlying social, economic, and environmental determinants of health. Next is primary prevention, which refers to actions taken before the onset of a disease to prevent its occurrence. Primary prevention interventions target the pre-pathogenesis phase of a disease and focus on health promotion and specific protection. Examples include immunizations, health education, regular physical activity, and healthy diet promotion. After primary is secondary prevention, which involves early detection and intervention to halt the progress of a disease at its incipient stage and prevent complications. It is applied when a disease has possibly set in but has not yet caused significant symptoms or damage. The main modes of intervention at this level include early diagnosis through screening programs and prompt treatment. Last is tertiary prevention, which is applied when a disease has advanced beyond the early stages and aims to reduce impairments, disabilities, and minimize suffering caused by existing health conditions. It focuses on disability limitation and rehabilitation to improve the quality of life for individuals with chronic illnesses or disabilities. Examples of tertiary prevention include physical therapy for individuals with mobility limitations or rehabilitation programs for individuals recovering from a stroke. The changing concepts in public health can be summarized into four phases: disease control phase, health promotional phase, social engineering phase, and health for all phase. Let's revise these quickly. First up is the disease control phase, which was from 1880 to 1920. Health promotional phase was from 1920 to 1960. Social engineering phase, which lasted from 1960 to 1980. And lastly, health for all phase from 1981 to 2000. In the early 2000s, the United Nations established the Millennium Development Goals as a framework to address major global health and development challenges. These included specific targets for reducing poverty, improving maternal and child health, combating infectious